Identifying drug-related problems. This topic is divided into three installments. This first part, I will discuss the background of drug-related problems and their categories. The second installment will be about the detailed explanations of the categories, and the third part is on how to report DRPs and some sample cases to practice on. For most diseases, drug therapy enhances health-related quality of life. However, inappropriate use of drugs may be harmful and could evoke side effects. Drug therapy is growing more complex, thus making appropriate patient management increasingly challenging. A drug-related problem, or a DRP, is defined as a drug therapy problem, any undesirable event experienced by a patient that involves or is suspected to involve drug therapy and that interferes with achieving the desired goals of therapy. Accordingly, in clinical medicine, a wide range of DRPs may arise. Optimization of drug therapy and preventing DRPs may save some of the healthcare expenditure, potentially save lives, and enhance patients' quality of life. Previous studies have largely addressed DRPs as a cause of hospitalizations, even in elderly and ambulatory care, and nursing homes and hospitalized patients. Drug therapy problems are the clinical domain of clinical pharmacists. The purpose of identifying drug therapy problem is to help patients achieve their goals of therapy and realize the best possible outcomes from drug therapy. In the next slides, we will discuss the background, the components, and the categories of drug therapy problem, and their central importance to the practice of pharmaceutical care and medication management services. The objectives for this activity are the following. First and foremost, to promote patient safety. This can be done by identifying drug-related problems and also know and present the issues involving drug-related problems. These are the reading assignments before we start learning this activity. Patient safety, medication errors, drug therapy problems, article writing, adverse drug reaction reporting, ADR, detection, assessment, reporting, and prevention. This learning activity uses two learning resources. The book entitled Pharmaceutical Care Practice by Cipollet et al. And the Pharmaceutical Care Network Europe. The current version of this Pharmaceutical Care Network Europe is version 8 that was updated last April 2017. This classification is for use in research into the nature, prevalence, and incidence of DRPs, and also as a process indicator in experimental studies of pharmaceutical care outcomes. It is also meant to help healthcare professionals to document DRP information in pharmaceutical care process. Let's define first DRP. DRP, or drug therapy problem, is any undesirable event experienced by a patient that involves or is suspected to involve drug therapy, and that interferes with achieving the desired goals of therapy and requires professional judgment to resolve. It is a drug-related problem, an event or circumstance involving drug therapy that actually or potentially interferes with desired health outcomes. These DRPs, if not resolved, it will have clinical consequences. As clinical patient problems, DRP also require professional clinical judgment to be resolved. The characteristics of requiring professional judgment place drug therapy problem at par with other clinical problems in medicine, dentistry, and nursing. Every healthcare practitioner is responsible for helping patients with problems that require a certain level of professional sophistication to identify, prevent, or resolve DRP. And hence, the very most important healthcare practitioner that can handle these DRPs are the clinical pharmacists. So we are expected to have that sophisticated intelligence in identifying, preventing, and resolving DRPs of our patients. Components of the drug therapy problem. To identify, resolve, and prevent DRPs, the practitioner or we clinical pharmacists must understand how patients with DRP present in the clinical setting. This has three primary components. First is the presence of undesirable event or risk of an event experienced by the patient. The problem can take the form of a medical complaint, sign, symptom, diagnosis of disease, illness, impairment, disability, or any laboratory value that is abnormal, or a syndrome. These events can be result of physiological, psychological, sociocultural, or economic conditions. Also, the presence of drug therapy that is the patient is taking, and that is associated with the problem that is presented above. Third component is the relationship that exists between number 1 and number 2, between the undesirable patient event and the drug therapy that the patient is taking. This relationship can be a consequence of drug therapy, suggesting a direct association or even a cause and effect relationship. The need to add or modify drug therapy for its resolution or prevention. Stating the problem and identifying the cause require all of these three components to be known. This step involves clinical judgment by the clinical pharmacist. There is no right answer as to whether or not a drug therapy problem exists. There is only the practitioner's clinical judgment or the clinical pharmacist's judgment and their rationale for the decision. This is the reason why we clinical pharmacists can contribute uniquely to patient care. So this is the very forte that we have to master in order to be valuable in pharmaceutical care or in patient care. No other practitioner can identify and resolve drug therapy problem as routinely and comprehensively as clinical pharmacists in the wards or in patient-centered approach. Now, let us describe drug-related problems according to CIPOLE and PCNE. In the left box, these are the 7 main descriptions according to CIPOLE. These 7 categories should not be confused with our traditional rational use of drug, which are the correct drug use, correct drug dose, correct route, correct frequency, correct duration, that is just based on a prescription. Our old rational use of drug is prescription-focused approach that establishes the prescribing and delivery of the drug product and not on the patient's clinical condition. That fails to include our patient. We forgot that drugs do not cause toxicity until they're taken by our patient. Drug product cannot prevent disease unless they're taken at the appropriate time and at the appropriate dosage by our patients. Drug products cannot cure a disease unless until a sufficient dosage is provided to be taken by our patient. Therefore, our drug therapy can be considered successful or a failure by our patient. Now, let's have the 7 categories that is patient-centered base. First, the drug therapy is unnecessary. There is no clinical indication that the patient is manifesting. Second, additional drug therapy is required to treat or prevent disease, meaning the patient has manifestation that has no medication at all, or there should be additional drug to be given in order to prevent a disease. Third, the drug is not being effective at producing the desired response. Fourth, the dosage is too low to produce the desired response. Fifth, the drug is causing an adverse reaction in the patient. Sixth, the dosage is too high, resulting in undesirable effects. 7. The patient is not able or willing to take the drug therapy. Knowing that there are only 7 basic categories of drug therapy problem is a powerful concept for students and practitioners. These categories define the set of problems that might be caused by DRP and that can be resolved by drug therapy, and therefore describe the scope of responsibilities of the clinical pharmacist. On the other side is the PCNE, 3 main domains of DRP problems. So the problems are categorized according to treatment effectiveness, treatment safety, and others, which includes cost effectiveness, unnecessary drug treatment, and unclear problem. This table presents the unmet drug-related needs that produces the aforementioned 7 categories from CEPOLA. The first 2 categories of drug therapy problems are associated with indication. The third and the fourth categories are associated with effectiveness. The fifth and the sixth categories of DRP are associated with safety. The seventh category deals with patient adherence. This order of problem assessment that should start from indication, effectiveness, followed by safety, and the last one, adherence, is significant in our rational decision making, especially in making our pharmacotherapy workup as clinical pharmacists. You note that the first 6 categories of drug therapy problem describe clinical problems that the patient experiences, resulting from the actions of the drug to the body. These 6 categories are differentiated from the last one, which is the most unique and most important. This is the adherence or non-compliance that results from the action of the patient concerning the willingness of the patient or the ability of the patient to use the medication as instructed. So it is very important that the clinical pharmacist knows how to instruct, knows how to convey, how to communicate to the patient, to convince the patient, and to educate the patient completely. These categories of drug therapy problems are not specific to pharmacological class, area of practice, medical service, or level of practitioner, education, or training. DRP categories are also not specific to a unique patient group. Hospitalized patients are the same with ambulatory patients. These categories also applies across all patient, practitioner, and institutional variables. This categorization is very important because it helps serves as the focus for developing a systematic process of problem solving whereby we clinical pharmacists can significantly contribute to the positive health outcomes of our patient. This is also useful, these categories are also useful in our team-oriented healthcare delivery system. Now let's discuss the medication use process. Now let's discuss common causes of drug therapy problem. CEPOLA has the same categories for the causes of DRPs, which were the 7 categories mentioned before. Now, according to PCNE, it has 8 domains of causes. That starts with drug selection, drug form, dose selection, treatment duration, dispensing, drug use and drug process, and patient-related, and others. These different causes from different resources will be fused and will be discussed in details in the second part of the lecture. But for now, this would be all for for the first part. I hope everyone is enjoying the online lecture, and thank you all for listening.